today we are doing a shoulder treatment video, but more specifically, deltoids.
Yeah, the deltoids. Actually, the deltoids are actually kind of interesting. We can split this kind of into three groups. So there's an anterior or the front, there's a middle, and then there's a posterior or the back side to this muscle. The fiber direction kind of runs differently, so that's why we're going to kind of treat them individually, but it's just one group, all right? So these muscles get overworked constantly. We use them in so many different types of movements. So the type of pain that's associated with this most of the time is going to be anybody who has any pain doing anything overhead. So whenever you get to about this motion, about here, and then you feel like a catch or you feel like a click or anything like that, and then you continue to have pain up here, it's more than likely going to be your deltoids that's causing that problem. Also, if you've been to the doctor and you've had an MRI done or you've had x-rays and they say that your shoulder and your rotator cuff is fine, it's more than likely your deltoids that's causing that same kind of like rotator cuff pain. As well as impingement syndrome also. If your physical therapist or your doctor's ever told you that you more than likely have impingement syndrome, meaning one of the nerves is cut off in there, it's probably just your anterior deltoid and your middle deltoid. You got some sort of trigger point that's putting a lot of pressure. But yeah.
And even if you're not having pain, I know a lot of weightlifters that when they're doing flies, they talk about feeling their shoulder click. And a lot of times that's because deltoid is too tight and it's holding the shoulder in a funky position.
Yeah.
So, well, let's get to this. You need to grab a ball and you're gonna need a blank wall to do this exercise. So feel free to pause the video and jump back in with us. We'll see you there. All right, now that you have your ball and you have a blank wall space that you can lean up against, we're going to treat mid-deltoid, rear delt slightly, and anterior delt, okay? So this is going to take a few minutes. We're gonna spend a few minutes on each area, and make sure that you're following the 1 to 10 pain scale. We're gonna keep you guys on a 5 to a 7.
5 to 7.
Yeah, and if you need more information for that, go ahead and check out our very first video on what a trigger point is and how to treat it. That way you know exactly what you're doing if you haven't already, okay? So grab your ball, go ahead and find that mid-deltoid trigger point. There's one right in here, and let's lean up on that and release it. Mine's right there. And I can feel this running down my arm a little bit, like to about right here. Did you find one?
Mine's just in a general area.
Okay. And remember, it takes about 10 to 15 seconds for most people for the trigger point to release. So it should start to get better in that 10 to 15 second range.
Yep, and then you want to creep over just a little bit because there's definitely a friend nearby.
Yeah, make sure that once that spot releases, you move just a little bit, like mine's already gone, and then boom, right there I've got another one. I barely moved, like a centimeter. And now that spot has released for me, so I'm gonna move just a little bit more, find another one right there. And let's move just a little bit more while we're in this mid-deltoid. Find one more for me. Okay, now let's roll around to anterior deltoid. This may be a little funky because you're going to have to face the wall, okay? So don't mind looking at our backs for a second.
Yeah,
Bree will show you where you're rolling.
Right in this region about.
Okay, and you'll notice, Bree, will you go ahead and just keep showing them where to put the ball?
Yeah. Okay, so what she's doing right now is technically an active release or ART technique. When you're compressing a trigger point, sometimes it helps to add the movement of what that muscle does to kind of help break up the fibers and fascia that's in between there. But she's right here in the front part of the humerus or your arm bone here.
And these radiate even to the back of the shoulder. If they couldn't hear me, you can explain that.
Yeah, this radiates kind of generally the whole shoulder area, as well as kind of sometimes feels like inside of the joint as well.
Yeah, it feels like it's in the center of the shoulder for me right now, at least.
Right here.
Okay, so now let's do the other arm. Ready? We're gonna do mid delt, rear delt, and then anterior delt. And remember, find something that radiates or a hypersensitive area.
Yeah, because like we were saying in our intro to trigger point therapy, sometimes it doesn't radiate to a different part of the body. Sometimes it's just right there localized. But we're always aiming to find usually the spot that hurts the most within a muscle, because we want to get rid of those larger trigger points.
And be patient. Sometimes when a trigger point releases, you may feel a spike in pain. It may get a little worse before it gets better. And that's normal. You just released the surface fibers and you're getting into a little deeper area that's maybe been there longer. So it might be a little bit more ischemic, might be a little bit more painful for you.
And don't forget to keep moving. Find a spot, sit on it for about 15 seconds, or as long as it takes for it to kind of settle down, and then move just slightly to a different area.
Oh, you know, it's interesting, in this left shoulder, I'm in a trigger point in mid delt, and I can feel it kind of going up towards my neck a little. I don't get that one very often. Okay, and let's roll around to rear delt.
And now you still want to be on the arm, on the actual arm. You don't want to be on your shoulder blade or on your back for this. You want to make sure that you're still on the humerus.
You're right here. And notice how we're leaning in. Like if I want more pressure, I can lean in. If I want less pressure, I can stand up a little straighter. Okay, now let's make our way around to anterior delt, and I'll show it this time, that way you can treat yours. So anterior deltoid is right in here. And this is probably the worst trigger point in deltoids. Mid delt is pretty bad for most of us, but anterior delt really mimics that rotator cuff injury pain that people have, like Bree mentioned before in the beginning of the video. Sometimes we go in thinking we have a rotator cuff injury and we get an MRI. The doctor doesn't find anything. These trigger points are often the culprit if you've exhausted your other resources and you know that your joint is okay and your tendons are okay. All right, and that should be pretty good for the deltoids. Now we're going to stretch them. The first one that we're going to do is anterior delt. Using a wall or a door frame, since we're already on a wall, go ahead and put your arm behind you here. And try and turn away from the wall. Some of you might not be as flexible as I am, and you might be right here and feeling a stretch, and that's okay. Just trying to turn away. I also like to play with the angles when I'm in a stretch so that I get all of the fibers of the muscle. So I'm going to go a little higher than center. Now I'm going to go a little lower than center. And that feels pretty good. Let's do the other one. Higher than center and lower than center. I can definitely feel a difference in the anterior delt that I rolled versus the one that I didn't. So, and palm facing you, elbow straight, pull that arm over. This gets rear delt nicely. And the other one. All right, shake that out. So as we mentioned before, if you haven't checked out our intro to trigger point therapy video, go ahead and check that out. It's useful for you to understand what a trigger point is, how to feel it, and how to release it.
Yep. Also, if you want to follow up with that, there's an intro to stretching in case you kind of not really sure what a stretch should feel like and things like that. Check out that intro to stretching video just real quick. Other than that, stay tuned. Make sure you're turning on your notifications if you're on Facebook or Instagram, or if you're on YouTube, make sure you hit like and subscribe.
Yeah, share this with a friend if they've got some shoulder pain.
That too.
All right, see you guys in the next video.